Vestibular disorders, prevention and treatment. Hi. Our vestibular system is located in the inner ear, composed of vestibular organs and vestibular nerves. The vestibular system integrates the capsule, the saccule, and the three semicircular canals. These elements are filled with fluid and covered with sensory hair cells. Thanks to their special structure, these components of the vestibular system have the function of detecting head movements, providing the brain with important data about orientation and spatial balance. Therefore, the vestibular system plays a key role in maintaining balance and spatial orientation. Every time a person's vestibular system malfunctions for some reason, they will experience a series of symptoms known medically as vestibular disorders. When suffering from vestibular disorders, what symptoms may patients see? Although vestibular disorders can be caused by many different causes, in general the main symptoms of vestibular disorders are usually dizziness, lightheadedness, loss of balance, nausea, and difficulty concentrating. The severity and duration vary in each specific patient case. What types of vestibular disorders are there? Vestibular disorder syndrome is a manifestation of many different types of diseases that cause vestibular disorders. Below are some common types of diseases that cause vestibular disorders. 1. Benign paroxysmal positional vertigo. This is a disease characterized by transient bouts of vertigo caused by specific head movements. The cause of benign paroxysmal vertigo is due to a problem in the inner ear. The disease arises from crystals shifting in the inner ear, disrupting the flow of fluid. 2. Meniere's disease. Meniere's disease is an inner ear disorder that causes dizziness, nausea, sensory neural hearing loss, and tinnitus. Due to the accumulation of fluid in the inner ear, it causes dizziness, hearing loss, and tinnitus. Although the exact cause is unknown, genetic factors and abnormalities in fluid regulation may contribute to the condition. 3. Vestibular neuritis. Vestibular nerve, the eighth cranial nerve, is inflamed and swollen, leading to symptoms of vestibular disorders. In fact, vestibular neuritis can have a viral cause, and of course is accompanied by impaired neurological function. 4. Labyrinthitis. Labyrinthitis usually appears in adults between the ages of 30 and 60, and women are twice as likely to have the disease as men. Labyrinthitis is an inflammation of the membranous labyrinth of the inner ear and often presents with dizziness, nausea, vomiting, tinnitus, or hearing loss. The cause is usually a bacterial or viral infection but can also be due to an autoimmune disorder or a virus that suppresses the immune system. Although most recover fully, there is still a risk of loss of balance and hearing problems. Proper treatment and symptom control are important to prevent deafness and peripheral vestibular dysfunction. Who may be susceptible to vestibular disorders? The following are high-risk cases of vestibular disorder syndrome. 1. Adults over 40 years old. Many vestibular disorders, such as Meniere's disease and vestibular neuritis, tend to occur more often in adults over 40 years of age. 2. Women. Some vestibular disorders, such as Meniere's disease, are thought to affect women more than men, although the reasons for this disparity are not completely clear. 3. People with a history of head injury. People who have suffered trauma or injury to the head, such as a concussion or skull fracture, are at increased risk of developing vestibular disorders due to damage to the inner ear or vestibular nerve. 4. People with a history of inner ear infections. People who have had previous inner ear infections, especially those caused by viruses, may be more susceptible to vestibular disorders later in life. 5. People with family history. In cases where genetic factors play a role, people with a family history of vestibular disorders, such as Meniere's disease, may be at higher risk of experiencing the same condition. How is vestibular disorder diagnosed? Accurate diagnosis is pivotal for effective management. Healthcare practitioners employ medical history reviews, physical examinations, and specialized tests such as electronystagmography (ENG) or videonystagmography (VNG) to pinpoint the specific disorder. How are vestibular disorders treated? Here are some popular approaches to treating vestibular disorder syndrome today. 1. Medication. Depending on each specific case, patients with vestibular disorders may be prescribed medications by doctors that help reduce symptoms of vestibular disorders. Medicines such as meclizine or beta-histine reduce dizziness and vertigo. Corticosteroid medications reduce inflammation, especially in cases of vestibular neuritis or labyrinthitis, and anti-nausea and vomiting medications. 2. Surgical intervention. Surgical intervention is a solution only for cases that are refractory to conservative treatments or are associated with structural abnormalities. Options include endolymphatic sac decompression, vestibular nerve resection, or labyrinthectomy. 3. Canalith repositioning procedures. Canalith repositioning is a procedure that can help relieve benign paroxysmal positional vertigo, vestibular disorder. Vestibular disorders occur when small canalith stones, also called otoconia, in part of the inner ear break off and fall into the canals of the inner ear. Canalith repositioning procedures are performed to move otoconia from the fluid-filled semicircular canals of the inner ear into an open area that resembles a small sac, the vestibule. At that time, these particles will not cause dizziness. They are likely to dissolve or be reabsorbed by body fluids in the ear. 4. Lifestyle modifications. Adjusting your diet, controlling stress, and modifying your activities reduces symptoms. Reducing salt intake, stress reduction techniques, and avoiding stimulating activities help enhance symptom control. And 5. Physical therapy, yoga. Physical therapy works to facilitate adaptation and compensation for vestibular dysfunction through specifically targeted exercises. For example, gaze stabilization exercises. These exercises are aimed at improving visual stability during head movements, helping patients maintain concentration and reducing dizziness or lightheadedness. Examples might include practicing visual tracking exercises or making head movements while focusing on stationary objects. Balance training. Balance exercises focus on improving stability and reducing the risk of falls by enhancing proprioception and coordination. These exercises can include a variety of activities and a variety of positions such as standing on one leg, walking on different surfaces, or using a balance board or stability ball. Habituation exercises. Habituation therapy involves exposing patients to specific movements or environments that trigger symptoms of dizziness or lightheadedness in a controlled and gradual manner. Over time, repeated exposure will help desensitize the vestibular system, reducing the intensity and frequency of symptoms. And conditioning exercises, conditioning exercises aim to improve overall fitness and endurance, which may contribute to better functional outcomes and reduce the impact of vestibular symptoms on daily activities. Examples may include cardiovascular exercises, strength training, and flexibility exercises. So, vestibular disorder is a great challenge for those who are suffering from it, because of difficulties in all positions and especially in movement conditions. To effectively prevent and treat vestibular disorders, in addition to leading an active and scientific lifestyle, you need to take early diagnostic steps and have multidisciplinary approaches related to ENT doctors, neurologists, physiotherapists, and audiologists, etc. Wish you health. Thank you, goodbye, and see you again.